Welcome to the Snapscale Show, hosted by Mike Yablonowitz and Nathan Bush. In every episode, we explore the real challenges and breakthroughs happening in modern healthcare operations, from navigating compliance to virtual staffing and emerging technology. You will hear real stories from clinics, learn from healthcare leaders, and uncover practical strategies that help you run a smoother, more efficient practice without losing focus on what matters most: patient care. Snapscale exists to take the pressure off your front office and administration work, so you can get back to doing what you love. Be sure to subscribe to our YouTube channel to get the latest episodes, and visit snapscale.com to learn more. Let's simplify healthcare operations together. This is the Snapscale Show.
What is going on, everyone? How are you? And welcome to another Snapscale webinar. Hey, just real quick, can you help me out? If this is your first webinar with Snapscale, can you do me a favor and just put 1 in the chat? And if it's your second webinar or third webinar, you've been with us multiple times before, you're a glutton for punishment, will you put 2 in the chat for me, just so I know who I'm speaking to, and I can make sure that I tailor a lot of the information specifically to what you would be looking for. So again, 1 if you're new, 2 if you've been through this before. Come on, I got to let our CEO know how much the psychiatrist bills are going to be for those of you that continue to come back and get it. No, I'm just teasing. All right, guys, I really am excited about this opportunity today to share with you, is a virtual assistant right to support my healthcare practice? Many times on these webinars, we go through with clinicians, or we work together with other consultants or other tech partners in the industry in order to equip you with resources and tools for your practice. Today, I want to showcase and share with you just this simple concept: is a virtual assistant right to support my healthcare practice? And we're going to uncover and discover that information today as we go along. Before we do that, though, the real bottleneck in healthcare growth isn't patient, it's bandwidth. Okay, I know it might feel like it, but it's not. Most practices hit a ceiling because they can't handle more work, not because they don't want to add more patients. It's literally because they can't take any more on. Your team's capacity, not your quality of care, is what's actually limiting your growth in your organization. And with working with hundreds of healthcare organizations throughout the years, I've also noticed that this growth, it's like every time you hand your team member a task or a phone call to do, instead of building a connection or a doorway in your practice to patient care and connecting the clinician with the actual patient, what ends up happening is every task becomes a brick that's actually blocking or bottlenecking that communication. It's one less thing, one less engagement that you're actually getting with your patients. But what if the right support system could multiply your impact? Let me ask you a question. If bandwidth is truly the bottleneck and we fix the bandwidth, would that be something that you would be interested in learning more about? Well, here's what I know. I know there's only really 2 solutions that you've been thinking of to fix this bandwidth problem. I know because I talk to healthcare clinics every single day, and this is what they say to me. Either A, their team is overworked, or B, they're hiring more and paying more than what they need. Is that your practice? Which one is you? Are you practice number 1? If you're watching this live or watching on replay, help me to know where you're at. Are you practice number 1? If you're number 1, put that in the chat. Or if you're number 2, put number 2 in the chat. You've hired more staff than what you can actually afford in your practice. Yeah, here's the thing though. What if there was a third, better option that was designed for scaling organizations without breaking your budget? Is that something that you would be interested in? If it is, hi, welcome. I'm Nathan. And I actually wanted to kind of go over real quickly my background with you, not to impress you, but to impress upon you who I am and kind of who's guiding you today. Number 1, I helped a Miracle franchise grow from 7 locations to over 47 locations. I was the vice president of operations and sales there and marketing there. I oversaw their clinical operations. I oversaw all the marketing teams, and I oversaw the call center. And what I found and what I learned was that you couldn't grow through bottlenecks. You had to grow through systems and delegation. Okay. And in doing that, Snapscale became my staffing partner. When I needed a staff member and I needed a team member to answer phones or take inbound calls or make outbound phone calls, Snapscale was my staffing partner. And so that's how I ended up with Snapscale. On this long journey, I learned that there is a real solution out there for bottlenecking healthcare practices. And that's what allowed me and helped me to scale Miracle as we were growing that practice. Secondly, I'm the senior vice president here at Snapscale, and I've had the wonderful privilege of serving hundreds of healthcare clinics in multiple different verticals with this particular service that we offer at Snapscale. I'm also the author of a book called The Caesar Method, Achieving Rapid Strategic Growth with this 6-step process. And this is how you can learn influence in your communication, okay? I wrote this book by measuring outbound phone calls and understanding the trustworthy and ethical way to influence other people who can have a better understanding of what you do and why you do it. And then lastly, I just wanted to share with you briefly, before we get too far into today's webinar, my mission. My mission, just in general, not even just today on today's webinar, but my passion and mission in life is to transform healthcare operations. And what I want to do is to elevate patient care and create a thriving, scalable business models across hundreds, if not thousands, of healthcare clinics throughout the United States. So if you're on board and understand kind of this background and who I am and how I can support you, I hope today's message then serves you. Because here's one thing that I've learned by scaling and growing all of these healthcare practices, okay? One thing and one thing alone. You don't grow by working harder. I can't say that any clearer and any better. It's going to be real difficult to scale and grow your organization if you can't understand this one concept. You don't grow by working harder. You grow by delegating smarter. And that's what today is all about. How to delegate, when to delegate, where to delegate. And we're going to learn all of that. And all of that is ultimately going to tell you if a healthcare virtual assistant is right for your organization. The big question, is the virtual assistant right for your practice? And here's the honest truth, not always, but often, yeah, today's session is all about clarity. You'll walk away knowing if you're ready to start and how to do this safely, okay? So if you hang in there with me, you're going to learn, are you ready to start? And how do you do this process safely? But see, really, there are 3 secrets that people probably don't tell you if you're trying to learn about healthcare outsourcing and how to use virtual assistants in a healthcare practice. And if you want to do it effectively, there's 3 secrets that people probably aren't going to tell you that I'm going to be direct with you today and share with you. I hope that's okay with you. Secret number one, we'll hop right into it, okay? Secret number 1. Let me ask this question before I even say what secret number 1 is, because it's up on the screen. Are you the type of person who ever said this before in your practice? I'll just do it myself. It's faster. Have you ever felt that way? Like, I'll just do it myself. I'll just jump in and do it myself. You're going to hear about a COO who would jump in and just help out in the front desk themselves. Is that you? If that's you, say yes in the chat. Because here's secret number 1. It has to be the right time to hire a virtual assistant. And here's what I've learned over many years of working with Snapscale. You don't hire VAs to fix chaos. You hire them to prevent the chaos. So yeah, if that's you, if you're the type of person that says, I'll do it myself, I'll just jump in and do the work myself. If that's you, type the Y in the chat. That would be really helpful for me, is if you go ahead and put Y in the chat if that's you. Do you ever just jump in and do the work yourself? Yeah. If that's you, you're my kind of people, because I felt the same way too, right? But I learned this. You don't hire a VA to fix chaos. You hire a VA to prevent chaos. So here's how you know. Let's see if any of these resonate with you and which ones is it that are resonating with you the most, okay? Remember back to the TV show Let's Make a Deal or Family Feud when they put it up on the screen. Is this you? Number one, you're missing calls or follow-ups. If that's you, put it in the chat. That's your organization's missing calls or follow-ups. Yeah. The second one here is your staff spends more time on admin, like pre-authorization or insurance verifications, than on patients. This tells you if it's the right time for you to hire a virtual assistant. Number three, you're deferring growth because of bandwidth issues. People just can't get to all of the work that needs to be done. Or number four, how about this? You're doing some of the low-value tasks yourself every single day, or your staff is doing very low-value tasks every single day. Can we just get an elevation of some of the work so that the team members feel a little bit more encouraged and engaged to stay long-term? How about this one? No one on your team knows exactly how things get done, but somehow they just miraculously seem to do it. But then you also have the other side of that where burnout and turnover are becoming the norm inside of your organization. Or maybe you're this last one here. Leads and referrals are falling through the cracks. Look, if you see yourself in any one of these, just type me in the chat. That really is helpful for me, and that engagement lets me know whether you're watching live or on replay. Just type me in the chat, and that just gives me some indication that what I'm saying is on pace with what you feel inside of your practice, because this is how you know if the timing's right. Look, if your practice matches this pattern, and you don't see yourself as the kind of leader who wants to break it, there might be a challenge there, not with your business, okay? The real opportunity in life comes when we recognize and realize that we have to break these patterns or these cycles in order to get growth. And so here is the VA readiness framework that we use. I'm going to show you a framework today that'll let you instantly spot if you're ready for a VA. So if you're ready for that, go ahead and put I'm ready in the chat. I'll go ahead and move ahead with this. All of you guys that are watching online, go ahead and put I'm ready in the chat, and I'll go ahead and share with you this framework that works really, really well. All right, there it is. Yep, it looks like people are typing I'm ready. They're ready to move ahead. Now, this will bring everything into focus, okay? And I'm also going to share with you one mistake that practices make, and that's this. Here's the biggest number one mistake that I see practices making when they're trying to determine if they're ready for outsourcing. You're not outsourcing. You're expanding your team's capabilities. And so they have this blocker or this barrier in their mind that they're doing something unique, and they're not. They're really just expanding their team's capabilities. I see you guys online. I'll type it. I'm ready. Here is the framework and the process that I use in order to be able to determine if businesses are ready to outsource. And it works around three things. And I ask these three questions all the time. Number one, people. Do you have enough hands to do all of the work that needs to be done? It really comes down to that when you talk about people in this framework. Do you have enough hands to do all the work? But then the second question that I ask, and sometimes this opens up more in conversation whenever I'm talking to clinicians and healthcare providers and business healthcare leaders and business owners, and that is, are all of your team members working at the top of their license? Meaning doing the most important patient care work that only they can do. If they're not, then your people may be drowning in low value tasks. You know what I'm saying? Like, you got to make sure that you're working through understanding that your people should be doing the highest value, most people-focused tasks in your clinic. And some of the more low-value tasks, maybe you just don't have enough people to do the work. The second question that we ask and that we focus on has to do around process and business. So the first in the framework, the readiness framework, is, do you have enough people? Are those people working at the highest of their license, and are they doing low value tasks? The second in this framework is process. Okay, if your workflows aren't documented, predictable, and repeatable, it doesn't matter how many people you bring in, they'll be still fighting the same fires over and over and over again. And so, do you have your processes documented? Do you have workflows documented? Do you have recorded documentation on how to do the specific role or job that you're looking to have a virtual assistant do? And then the last question that we have to ask, or series of questions, have to do around platform in the framework. Okay, so here's what I mean by platform. This is, what are your systems? Is your EMR system internet-based? Is your phone system internet-based? Messaging systems, video conferencing systems? Do tasks fall through the cracks because the tech isn't supporting the workflow? Meaning that you have to move something, you have to document things outside of the system somehow, shape, or form. You have to pull reports out of the system and manipulate them in specific ways. All of these things create gaps, okay? So ultimately, the three things in the framework are, do you have people gaps? Do you have process gaps? Or do you have platform gaps? Do you see how that works? When you pair those together, you begin to understand how ready you are within making the decision to bring on virtual assistants. And this frameworks help practices so that they can stop guessing and start making decisions based upon clarity. And during your readiness call with a Snapscale agent, we'll walk you through this process together and pinpoint exactly where you'll get the fastest ROI. So the readiness formula, again, when you're ready, these three areas line up: your people, your processes, and platforms. Which one is your biggest gap in your process, in your practice? If you, is it process, is it platform, is it people? Which is it in your practice? If it's people, put 1 in the chat for me. If the biggest gap is your processes, put 2 in the chat. If it's 3, the platform, put 3 in the chat. And if all of your systems, all your processes, and all your people are great, type 4 in the chat. Just interested to kind of know where you guys are at on this. If I helped you uncover anything yet through this process to identify, maybe it is about time to start looking at virtual assistants. Look, if I could help you diagnose this clearly in 15 minutes, would it be valuable to set up some time to talk with one of our team members independently? I think so. But let me just tell you a little case study from Evergreen Primary Care. Okay, Dr. Lisa Serbeck in St. Paul, Minnesota. She has a DPC clinic, direct primary care, and this is where patients pay her a monthly recurring fee. The challenge that she was having, she didn't use a lot of insurance. She just had direct pays from the patients who were paying for that reoccurring model. Okay, but the challenge she was having was that as volume grew and the doctor's work increased, they no longer could get their scheduling done effectively. They couldn't deal with the referrals anymore. Documenting things in their EMR became challenging. And so this limited growth and work-life balance became extremely frustrating. And Dr. Lisa Serbeck scoured multiple different virtual assistant style organizations and couldn't find anything that would fit her needs from a HIPAA-compliant standpoint until she came across Snapscale. Snapscale provided her a HIPAA-certified virtual assistant, and that virtual assistant then was trained on her EMR system and her Spruce system, which is her communication platform. And here's what the overall impact was. That VA now manages all of the billing. So when the credit card expires, they reach out, they get the new information, they get to make sure the patients are set up inside the system properly. Their virtual assistant is doing all of their prior authorizations at this point, and they're dealing with a lot of the documentation in the EMR. This freed up all the doctors. So now this practice not only is starting to grow again, but it's thriving, and the doctors have a better work-life balance. And here's what Dr. Lisa Serbeck, the co-founder of Evergreen Primary Care, had to say. This is the kind of practice we envisioned, and Snapscale helped us achieve that vision. And so you can see here the freedom that virtual assistant established for Evergreen Primary Care. Look, if your clinic experienced these results, wouldn't that free you up in time and revenue and less stress? All of the above maybe for you, right? All right. So we talked about timing, and that's important, right? We got to know if it's the right time to hire a virtual assistant. But secret number 2 is, what do I delegate? right? So I know that if I have these issues, but what am I supposed to specifically delegate in order to utilize a virtual assistant like some of these top practices that are getting great results with HIPAA compliant healthcare virtual assistants? Okay, so here's the thing. It's role clarity. It's role clarity. That's what we're going to talk about in this next section under secret number 2. How do I know what to delegate first? And look, scale happens when everyone works at the top of their license. So we have this top of the license model that I've been thinking about and playing around with, and I've been able to bring it to you and help you kind of understand what I mean by top of the model, top of the license model. Okay, here's the important things. Clinicians should focus on patients. In-office staff should focus on the patient, the interaction with the patient. The closer you are to the patient, the more energy and engagement you have with the patient, the more you're working at the top of your license or where you're allowed to work. Look, you can't have your front office staff or you can't have in-office staff doing work that they're not licensed for. But as all of the work that can get done as close to that licensing that's needed as possible, that's what you want to have your team members do. And so which group in your office is currently doing lower level tasks? Let me ask you that. Is it the clinicians? Are they doing more lower level tasks? How about your in-office staff that you do have? How about you? Are you doing more than you should be? Or is it just everybody? Who is it in your practice that's doing the lower level tasks like handling inbound calls, making outbound phone calls, back-end workflows like pre-authorizations, insurance verifications, the repetitive administrative tasks? Who's doing those? Are they really working in their zone of genius, their best strength, and what they're licensed to do? Look, if your team only did top of the license work, would your patient volume and your revenue increase? Yes or yes? What do you think? All right. So now that we've talked about top of the license, let's talk about specific tasks that you would like to hand off first. Let me ask you, which one of these tasks do you think that you would hand off first to a virtual assistant who could do this work? Remember, delegate what's predictable, keep what's personal. Are you going to delegate scheduling and appointment confirmations? Is that the first thing you delegate? How about inbound phone calls and no-show follow-up phone calls? Or how about insurance verifications and renewal coordination? Or how about pre-authorizations or EMR data entry or referral management? Or how about voicemail triage or inbox email management? Which one of these are you planning on delegating first? That will help you to determine what to delegate, right? Which one of those for you do you think would be the easiest for you to get off of your plate? These are all what I would consider low-level, time-consuming tasks that are not at the top of the license. Anybody can do these with a little bit of training, a little bit of assistance and support from a manager. Anybody can do these roles. And so these are the types of things that if the cost is lower than your in-office staff and the output is higher, is that worth exploring with a Snapscale agent? This is a question to throw out there with these different tasks. But don't just take my word for it, right? I've been talking a lot today about the different timing and tasks that can be delegated, right? The timing when to delegate and the tasks what to delegate. But don't just take my word for it. I'm not the only person that's delegated these types of things to virtual assistants before. We had another clinic, EA Therapeutic Health. Look, the clinic saw a 25% drop in outstanding insurance balances, and their collections improved by 15%. This was a super simple case study, but what was interesting about this is it wasn't just collections. See, our virtual assistants worked a tech platform. It's a kiosk inside of EA Therapeutic Health's front office. And so their entire front office staff is now a kiosk that's supported by Snapscale that is our virtual assistant. We have become their front desk. And what their COO had to say is up there on the screen. She said, we just kept hiring and hiring, but people weren't staying. You ever have that feeling? You're hiring and hiring and people just don't stay in the practice. You're training them. It's becoming time consuming. And by the time they were finally efficient, boom, they're gone onto a different role. Now, the front desk never shuts down, she said. Even when no one's physically there, Hybridge, which is that kiosk platform I was telling you about, which is powered by our Snapscale VA, is working and our HVA team is on it. That's EA Therapeutic Health. But it's not just EA Therapeutic Health. It's not just direct primary care, Evergreen Primary Care. How about Parkchester Medical out of New Jersey? Parkchester Medical is a variety of different medical practices all under one roof. They have primary care and a variety of other things that are there. And the results here, Blaine, one of their executives, said this: as far as immediate benefits, we've seen a decrease in cancellations and hold times as a result of our new communication cadence. This was immediately reported as soon as they started outsourcing. And what's fascinating to me about that is that that's better care. Right? You have decreased hold times and fewer cancellations of appointments. That's what we're looking for inside the office. Those are types of things that drive revenue and NPS score. Who wants these kind of results in their practice? If you're watching online, you're watching live or on replay, who would like these types of results in their practice? If that's you, just type yes. That will let me know that you're paying attention and you haven't quite fallen asleep yet during our conversation we've been having. But if that's you, type yes. Yes, you want these types of results in your practice. I think anybody would be wise to want these types of results in your practice. But here's what I think is more wise. When your team stops fighting fires, they can start building your future. What do I mean by that? Well, it really comes down to one simple thought process, right? You're either planning to fail or failing to plan, right? We've heard that old saying over and over again. But when your team finally stops fighting fires, they can start building your future. I just wanted to sit with you for a second because I think a lot of people rush into just hiring people to fix problems or putting another process or procedure in place or paying for another platform, and they never take time to really digest exactly what I'm saying here whenever I put this quote up on the screen or whenever I use this in conversation. When your team stops fighting fires, they start building your future. How is it possible? How can your team now start building your future? I'm going to talk to you all about how that's possible in secret number 3. Now, we've talked about timing and we've talked about delegation and what to delegate and clarity of role. But let's talk about secret number 3. What are top healthcare practices doing to integrate their virtual assistant, right? Because that's secret number 3, integration. If you don't integrate properly, then you're going to not have a good situation with your virtual assistant. And I have worked with practices that the integration was a real challenge. So I'm going to share with you what the top practices are doing to integrate, okay? Your VA only wins if your systems win. And so integration is everything. And what are these systems then that you specifically need? I'll go over those 5 systems with you in just a second. But before I do, if compliance is non-negotiable for you, would a HIPAA-trained and certified virtual assistant that's backed by a Snapscale BAA that we sign directly with the practice, the US-based organization signing with your practice, with a controlled access peace of mind, would that bring you peace of mind? Would a HIPAA-compliant, BAA-signed, controlled access organization bring you peace of mind? Let me break it down to you like this. If you're wondering about HIPAA compliance, how do you do HIPAA compliance in a remote staffing environment? I'll tell you, those are the 3 most critical pieces, is that your staff member has a HIPAA certification, they've gone through the training, the US-based company signs a BAA with your organization, and they have controlled accesses for the virtual assistant. Now, let me give you some examples of those controlled accesses within the Snapscale platform. If you're talking about in-office workers, okay, people who come to our offices in the Philippines, here's what you have to understand about these virtual assistants. Number 1, they are badging to get in. They're logging into our computers on our network. They're behind our firewalls and servers and all of those types of things. And so we don't just have a HIPAA organization. There's 3 types of companies, right, when it comes to HIPAA. There's people who do their HIPAA certification when they're supposed to. Okay, that's fine. Then there's ones that are conscious about HIPAA. They don't share private health information. It's part of just the organization, right? That HIPAA is important. Then there's cultural-based HIPAA organizations, which are organizations that have policies and procedures in place that are enforced so that these policies and procedures don't get broken. For instance, your virtual assistant can't search other sites on their computer unless that's part of their role or their job. They can only go to the sites that are set up for them to work on your specific account. I wonder if your current practices in your office have your computer systems locked down that much. Maybe you do, maybe you don't. But HIPAA's that important to us that we have a cultural-based organization that's focused on these HIPAA protocols inside of our offices. And we're the first in the world organization to set up what we call the safe-based initiative, which is if you have a role that's a little bit more tough or difficult to staff for, we actually have remote workers where they can, we have people who go to their house that set them up on our computers, on our networks. They're plugged in with an Ethernet cable. And these remote workers, maybe you're looking for somebody that's bilingual, that's a little bit more difficult to get to come into the office. Well, these remote workers will sign a remote HIPAA readiness agreement, and we'll do the audits of their home, making sure that they have a locked door, that they're using our computers. Those things are all plugged in, all things I mentioned already. And that was set up by our third-party consultant that we have called Digital Compliance. Digital Compliance is our third-party HIPAA consultant that we use to audit us, that set up our HIPAA protocols, that helped us design our BAA for you. And so HIPAA compliance, digital compliance, is important to our organization because they helped us with the HIPAA compliance. And so these are things that we just know that we do hands down top of the world in our approach to making sure that your clients and your patients' private health information is protected, because honestly, you can't scale without safeguarding trust. And HIPAA is one of those things that just you can't have violations on because it'll break trust with patients. Okay, so I told you that I would go over the 5 systems with you, and I will. These are the 5 systems that you have got to have in place to integrate a virtual assistant effectively into your organization. And so this first system here is your onboarding system. This is where you're going to connect your new hires with purpose, okay? I always talk about in healthcare, you've got to have both sides effectively working in your organization. You got to have the head, which is the financial, and you got to have the heart. And so whether it's a virtual assistant or not, you got to get them bought in to what you're doing and what you're accomplishing and how you're making a difference. And so your virtual assistant's no different. How do you get people bought into your mission? That's through your onboarding process. What do you do in your organization? You should also have standard operating procedures, documents with repeatable workflows, sometimes recorded videos or trainings that you've already done or pre-recorded. Those things are extremely helpful whenever you're starting to set up virtual assistants. A lot of people ask me, well, this seems real complicated, Nathan. How do I do that? A workflow or documented workflow is nothing more than a checklist for a process in your business. So how do you answer a phone? Create a checklist. How do you call that appointment verification call back or confirmation phone call? Make a checklist. What do you do whenever the patient doesn't show up and you call the patient back? Make a checklist. How do you deal with insurance verifications? Make a checklist. If you have a checklist, you have a workflow. And so that's duplicatable and repeatable, and somebody else can learn from that checklist. Here's the third one. Here's the third system you need. You need a communication system with your internal and external staff. You've got to have a daily sync with your team and a weekly rhythm. These 2 things alone will separate you in your leadership, but they will also, they're determinants of how successful you're going to be with outsourcing. Do you have a daily sync meeting and a weekly rhythm? That is a system that should be in place within your business. How about this? Compliance, ongoing training and audits for your business. And then the last system here is measure what matters most to you: response times, call volumes, NPS. Do you have a metric system that you're looking at metrics? Hey, if you have all 5 of these things in your business already, these 5 systems, you are ready to go with outsourcing. Let's go. That is the time to do it. Right now is the time to outsource. If you have the timing and it's right for you, if you know the tasks that you'll delegate, and you have these 5 systems in place, you are going to outsource like nobody else, and you will be very successful in the outsourcing that you are doing. All right, so I told you early on in the presentation that I wrote the book, The Caesar Method. I'm going to give you just a little brief overview of the Caesar Method and how it can apply to any time you're teaching somebody else or you're having conversation or connecting with somebody. So if you are making an outbound phone call, what do you document? What goes in that checklist? If you're making your confirmation phone call, lead follow-up call, no-show follow call, you tested somebody but they didn't take the treatment, or you offered a prescription and they didn't move ahead with it. How do you teach somebody what to say when they call the patient back? Okay. It's also a good communication platform when you're working with a team member. What are you working through when you're having conversations with your new virtual assistant? Here's what I'd say. If I'm meeting with my virtual assistant for the first time or the 50th time, I'm going to take time to connect with them. I'm going to make the meetings personal. I'm going to bring up things that are going on. If they talked about their family or shared information with me about things that are important to them, I'm going to reconnect around those things. If I know that something major is going on in their life, I'm going to talk about those things first. People want to feel a connection before we do anything. The next step in the process is we're going to ask and we're going to seek to understand by assuming positive intent in every situation. We're going to create feedback loops where I can ask questions and they can ask questions, right? Because by asking questions, we gain clarity. And so we have to ask before we move on to anything else we're going to do. A big thing is, have you ever used this EMR system before? What do you know about it, right? Have you ever used this phone system before? What do you know about these phone systems? Have you ever used this approach before? You want to make sure that you're gaining clarity and understanding before going into anything else that you're going to do in that conversation. So you've connected and you've now asked. Then we're going to educate them on whatever it is that we want to do. We're not going to tell them. We're going to educate. Just like this training today, just like this is a virtual assistant right for you. I'm not telling you what to do. I'm teaching you how other organizations do this successfully. And so the same is true when you're having communication with your virtual assistant. Then we're going to set the intention. We're going to define what success looks like early, and we're going to do it right here after we educate them. We're going to give them some definitive things that we want them to do. Then we're going to align interests. We're going to show them how those things that we just trained and taught on, that we've asked them about and that we've connected over, we're going to show them how it aligns to their role and outcomes in the business, right? That's critical. And then the last thing that I'm going to do is ask them if, once they're successful, if I can use their story with other team members in our team meetings. And so that way they feel encouraged, and then I can come back on the next connection and talk about the successes that they're having, right? This creates a positive environment for people. It creates trust. It builds long-term connection with your team member. And so I just encourage you that anytime you are working through conversation, whether it's with a patient, whether it's with a prospect, or whether it's with your new virtual assistant, that you follow a methodology that you know is going to create a positive outcome that you're looking for. And so let me tell you about a doctor that does that and does that well. Dr. Mahajan. Dr. Mahajan is the owner of the Podiatry Institute in Michigan, okay? And what's interesting about Dr. Mahajan's case is that he had chronic front desk issues, missed calls, no shows of patients, unreliable in-office staff that were disrupting patient flow and confidence. And so we determined what the root cause was, a staffing gap, but a system gap as well, because it was making sure that we define clear roles, that we had structure to onboarding, and that we got consistent coverage. So the solution ended up being that Snapscale deployed a full time HIPAA-compliant healthcare virtual assistant, Vince, who was trained on Dr. Mahajan's EMR and clinical communication protocols. And here was the results. We dramatically improved the patient responsiveness and satisfaction. We lowered overall internal stress and turnover. And we now have his practice that has a greater capacity for practice growth. And Dr. Mahajan had this to say about our service. He said it definitely brought stability to the office. Vince is there 40 hours a week answering phones, and patients are getting called returns faster. Look, If your front desk ran with this level of reliability, how would that change your patient's experience overall? Think about it. Think about it. All right, guys, we're almost done. We're coming up on an hour. And to finish up strong, I want to just share this with you. Remember, we talked about at the very beginning that every task that you give your staff is creating a barrier between the patient and the clinician, right? They become the bottleneck that's not, instead of building your business in a healthy way, they're blocking the doorway to that connection. Well, you can build a business without virtual assistants in healthcare, but with virtual assistants, it's much different. See, which side do you want to be on here? Look at the screen and you tell me. You want to be on a practice that has missed calls and a lot more chaos, burned out staff, bottlenecks everywhere, and limited growth? Or do you want the 99% of your calls captured? Do you want to balance your workflows? Do you want clear workflows? Do you want, less turnover, less frustration, and more scalable freedom? Snapscale helps you build the doorway connecting your clinicians and staff to your patients with HIPAA-compliant healthcare virtual assistants. That's what we do. Each task you hand your virtual assistant becomes a business building block that frames that doorway, okay? It frames the doorway to patient care and connection in your business. We want to make sure that we're coming alongside of you and helping you build your business with a model that works. And here's why. Because your practice should run like a system, not survive on sacrifice. If you feel in any way, shape, or form that you're sacrificing in order to get your business to where it needs to be, you need to have a conversation with the Snapscale representative. So here's what I want to do, okay? If you're watching this live or on replay, this is the 30-day challenge that you can do. This will absolutely help you. It will change your business in your life. Even if you're not ready for a virtual assistant yet, here's what I want you to do. Over the next 30 days, here's the action steps that you can take. Over the next 30 days, choose one repeatable task, document it clearly, and then delegate it and see if it saves you any time. So find something going on that you do, right, that can be delegated. Choose one thing, document it, make a checklist, right, and then delegate it to one of your team members. See, these small steps are going to lead to big freedom. And if you've done that, you have people gaps and process gaps and platform gaps, and you'd like to talk to somebody. Before you talk to anybody, I've got some solutions for you. If you just sign up to talk to somebody, we're going to give you a couple of different things. Number one, we're going to give you real case studies from real clients so that you can see some of these process and platform and systems and people gaps that we've already put solutions in place for and how we did that. Okay, so those are real case studies. When you scan that QR code that's on the screen right now, or you click on that link or go to that link and type that link in your browser that's on the screen, we're going to provide you with a series of real case studies, more than one, a bunch of different case studies that you can go read through at your own leisure. Number two, we're going to provide you a tool that's called the 7 Proven Ways to Reduce Patient No-Shows. If you ever had no-shows in your business, if you've had no-shows in your business, that QR code is calling your name. You're going to want to scan that QR code, because what will happen is that once you set up your appointment, you're going to receive a series of emails with each one of these different pieces of content and information that will help you and equip you in your practice, regardless of if you're ready for a virtual assistant or not. Okay, so if it's not the training guide, if it's not the case studies and it's not the training guide for the no-show system, then what you might be interested in is that you're actually ready for a virtual assistant. And so if you're ready for a virtual assistant and you have the conversations with us and you identify that you are ready for a virtual assistant, also that will be included for you is the Med2 method. This is how to onboard your virtual assistant. And lastly, how to train your virtual assistant. There was an article written by one of our other vice presidents here at Snapscale, and he put together a really good guide on how to train your virtual assistant. So onboarding, training, no-show management, case studies, everything that you need in order to better understand the platforms, the people, and the processes you need in order to grow and scale your organization. So I highly encourage you to go ahead and scan that QR code with your cell phone if you're watching on the computer, or if you're not, if you're watching on your cell phone, then just take a screenshot and go to a computer and plug that website in, and that will help you get to where you're going to schedule this readiness call and to get the different references we're putting out. Which one do you want to get first? That was it the case study, the training guide with the no-show systems, the onboarding guides? What is it? Which one do you want? Right. If we can reduce the stress, increase the bandwidth, and make your practice scalable again, would that be worth it 15 minutes? If yes, then grab your spot right now, guys. Just go ahead and go over to and scan that QR code, and that'll be beneficial for you. You'll be able to do exactly what you wanted to do, which is to reduce the stress and to see if that virtual assistant is right for your practice. You kind of know what you're looking for when you go into this conversation, now what you're going to be asked, the process that you'll go through, what we're going to talk about, and what would your practice look like if you stopped doing your team's work, or your team stopped being overloaded. And it was all this work, they weren't meant to carry, guys. You don't need more hours. You need more help. You don't need more people in the building. You need the right structure. You need an affordable model that you can scale with. If you're ready to redesign your practice and it serves you, not the other way around, okay? If you're ready to redesign your practice that serves you, book your VA readiness call. Just scan the QR code. Go to the link on the screen, either or, whichever one you want to do. It's 15 minutes, no pressure, just clarity. Gain some confidence, know what the next steps are. I only have a couple questions left for you. I know I've been asking a lot of questions on this so far, and I'll finish up with this. If not now, when do you plan on doing this? If not you in your company, then who? And if not this is the solution, then what? Book your readiness call and see if this is right for you. Again, use the QR code on the screen or go to the link at the bottom. All of those things will be really helpful for you. I truly appreciate the time that we've spent together today. You being here means a lot to me, so thank you very much. And again, catch us again on the next webinar. If you want to, we'll have another webinar coming out. Just look for us on LinkedIn. You can find us on Facebook. If you haven't registered, if you make sure that you get into our email list, and we can send you emails about when these different webinars are coming out. If you felt that this was helpful and felt that other webinars like this would be helpful. All right, guys, thank you very much. Thanks for your time today.